Hello, and thank you for joining the American Journal of Managed Care Oncology Stakeholder Summit Fall 2016 Peer Exchange Video Program. My name is Dr. Andrew Pecora. I am President of the Physician Enterprise Division and Chief Innovations Officer at Hackensack Meridian Health in New Jersey. I am also founder of Regional Cancer Care Associates, LLC, a large oncology practice. Joining this distinguished panel to share their perspective is Dr. Rena Conti, an Associate Professor of Health Policy and Economics for the Pediatric Department, Hematology Oncology Section, and for the Department of Public Health Studies at the University of Chicago in Illinois, and Dr. Brenton Fargnoli, an Associate Medical Director of Strategic Initiatives for Flatiron Health in New York. And joining us remotely will be Dr. Bhuvana Sagar, National Medical Director, Cigna Healthcare. Thank you again for joining us. Let's begin. I'd like to start by having my colleagues introduce themselves. Rena?
Sure. I'm Rena Conti. I'm an Associate Professor of Health Policy at the University of Chicago in the Departments of Pediatrics and Public Health Sciences.
And Brenton?
I'm Brenton Fargnoli, Associate Medical Director of Strategic Initiatives at Flatiron Health.
Great. Well, let's get started, guys. So as we know, we're in a transformative time in healthcare. We have an explosion in information and science and medicine. It's so exciting, but at the same time, physicians, patients, and our government itself is facing literally a crisis as it relates to healthcare reimbursement and expenditures. CMS, as well as other private insurers, have been developing tools that reward improved outcomes and high quality of care defined as alternative payment models. And everyone is talking about how are we going to move as a nation from fee-for-service to value-based reimbursement. So why don't we start, Brenton, with you to start to talk about some of the models that you're becoming familiar with and your thoughts about them.
Sure. I think I'd like to start with kind of the long history of alternative payment models that began outside of oncology. So patient-centered medical homes and primary care. In 2008, I helped in Rhode Island, Blue Cross set up a model with that. Then transformed over from primary care to ACOs. And now we're really using those learnings and tenets to apply to the oncology space. And we've seen a number of national payers piloting alternative payment models, and now the government as well. And so we can go into details on those, but at a high level, there's Anthem, who has a pathways or evidence-based medicine program. Cigna, as well as Aetna, are doing medical home models in oncology. United Health as well has a case management type program. And what CMMI and CMS have done is they've leveraged a lot of this work and piloting that's been going on with the national payers to roll out a quite ambitious payment model called the OCM. And I'm sure we'll get to this later, the details of that. But this now, we have national payers, the government, all working on similar alternative payment models for oncology.
Great. Rena?
So what I would say is there's a major transformation happening, particularly in the way in which government payers are paying oncologists, most notably Medicare. We used to have a system where we paid physicians fee for service, and what that meant is that they got paid for everything they did, and the more they did or the more intensive care that they provided, the more they got paid. Now we're moving towards a system of kind of dismantling the old fee-for-service system and moving into an area where we're kind of paying for value. And there are, I would say there are three kind of general types of these models. There's one which is fee-for-service with quality metric payment component. Then there's an alternative payment model that sits on top of a fee-for-service metric, but or fee-for-service payment model that has some other care management requirements. So Anthem Pathways program would be an example of that. And then finally, there are alternative payment models where physicians or physician groups are taking full or partial financial risk for care, and in exchange for more control over the finances, they're also in more control of the kind of whole bundle of care being provided to patients. ACOs, medical homes, those are types of models that fit under that rubric.
You know, so one of my concerns is, as we move to value, how do we guarantee patients they're going to get the proper outcomes, which means they're going to get the proper care? And as we go through this discussion, I'll be bringing that up over and over again.